Hi, my name is Mike Iwinski, and I'm one of the lead therapists here at Dream Life Recovery. Oftentimes when we have trauma, they become stuck in our body, and we have experiences and events that we don't like. Racing heart, sweaty hands, a mind that won't stop. These physiological symptoms can be debilitating to us. They allow us not to move forward in our day-to-day life. Brain spotting is a type of therapy that uses connection to your visual field to help process trauma that has been stuck. Brain spotting is used to treat a variety of different mental health conditions, predominantly anxiety, PTSD, substance use, even depression. As with any of the trauma therapies that we do here at Dream Life, you're always in the driver's seat. We would identify a trauma that you would want to work on. We'd talk about what that would look like in a session. We would spend some time engaging in breath work and grounding so that you would feel comfortable and safe before we would ever start processing anything. In a brain spotting session, we identify a spot that is connected to that trauma in your visual field. When I say that you're going to look for a spot in your visual field, we actually take a pointer and I drag it through your field of vision, left to right and top to bottom, and I find a spot where the trauma seems to be worse. You'll have physiological responses, deep breaths, shudders, blinking, which gives me a window as to where that spot is. So when you follow the spot, it's interesting because it becomes a fixed spot. Once we find that spot, we spend a lot of time letting your brain do what it needs to do. Unlike a lot of talk therapy, a lot of brain spotting actually happens within the brain. There'll be points throughout the session where they'll sit quietly and focus on the spot. And the brain rapidly goes through images, sensations, feelings. I'll check in periodically, but quite frankly, one of the goals of a good brain spotting therapist is to stay out of the way, to allow your brain to do what it needs to do. In both EMDR and brain spotting, even in somatic psychotherapy, the rule of thumb is your brain is adaptive and it knows how it needs to heal, and it wants to heal. It wants to return to a normal homeostasis state. And giving it time and little direction here and there allows it to do that. By the end of the session, most clients in a single session, sometimes two, report a great reduction in their physiological responses to that trauma. And then they may return to their primary therapist or a secondary therapist. It seems like their work just clicks, like it goes faster. All of the things that we've been talking about, all of the things that they've been learning in previous treatments seem to make more sense because they don't have all of this anxiety and stress and racing heart and physiological symptoms that are debilitating. The benefits of using brain spotting for substance use disorder is that predominantly across the board, when people come into treatment for substance use disorder, they either have a mental health condition or they have a trauma. Both of those oftentimes lead to physical pain, difficult memories, repetition of thoughts, racing thoughts, anxiety. Those lead us back into use. People don't like to feel that way, and so they use. So a modality of treatment that is able to reduce a person's anxiety, stress, is going to reduce their thoughts of use and help them better able to use the cognitive behavioral tools that we're working on.